60 million registered members, and private health insurance covers just about 2.4% of the insurable population of Kenya. That is both the policyholders and beneficiaries. And we must note that private health insurance is usually, most instances, a function of having policyholders who are mostly formally employed or covered by, sponsored by group medical schemes that is offered by their employer. Now, 44% of Kenyans, according to the survey, spend under 10,000 shillings annually on healthcare for themselves and their extended families. 15% spend between 10,001 shillings and 20,000 shillings. 10% spend between 20,001 shillings and 40,000 shillings. 7% spend between 40,001 and 70,000 shillings. 2% spend between 70,001 and 100,000 shillings. And very few spend between over 100,001 and over 250,000 Kenya shillings. What is interesting there is that just 19% indicated that they have health insurance that covers them and their extended family. So that is just about 1 out of 5 every Kenyans who have health insurance that covers them and their dependents. So what is spent annually on healthcare, by socioeconomic group? We see that for those who are spending under 10,000 shillings, 47% of those in the lower income bracket spend under 10,000 Kenya shillings annually on healthcare. And in terms of those now who have health insurance, you see very clearly there that 37% of those in the upper income bracket have health insurance that covers them and their extended family. 27% of those in the middle income bracket have health insurance that covers them and the extended family, and just 15% of those in the low income bracket have health insurance that covers them and the extended family. So you can see, the dichotomy, in terms of the spend by the low income group, and then those who are able to, access health insurance. Probably for their employer, from their own, personal initiative. But this is telling, and it should give us pause as to the state of healthcare in our country at the moment. But then, there's also the question of double taxation, because we all know that the right to healthcare is actually is a constitutional right. It is embedded in our constitution. The Constitution, I think, refers to affordable healthcare. That would be healthcare that is affordable to everyone. And we do know that in terms of the budget statement that was released this year, about the government set aside about 121 billion to cover health. Now, if you take the average spend by Kenyans on health, if you take 10,000 shillings as the lower limit, you will find that as a country, as adult Kenyans, we are spending about 112 billion on healthcare, which is 93% of the budget set aside by the government. So, quite clearly, there's a question there of double taxation. There's money set aside by the government, but we still have to dip into our pockets to sustain our healthcare needs, which should not happen. Now, in terms of management of the COVID-19 pandemic, is the COVID-19 pandemic increasing? About 44% of Kenyans seem to believe that the pandemic is, infection rates are indeed increasing. 31% believe that they're decreasing. 14% believe that they are neither increasing nor decreasing, and 11% do not know. Sorry, I'll take you back just a minute. There's something I need to mention here. There's the NHIF Amendment Bill 2021, which I'm sure some of you are familiar with. The NHIF Amendment Bill proposes to make contributions compulsory for every adult Kenyan at the rate of about 500 shillings per month, which would be about 6,000 shillings annually. So if you were to take the current number of adult Kenyans that we have currently, and just use that as your baseline, what we then see is that government, should the bill be passed, government will be collecting at least 154 billion annually through NHIF, which is meant to bring reality to the universal health coverage scheme. There are concerns about this. There are concerns because while we know NHIF, excuse me, there is that perception that perhaps the money is not, that the scheme, the health insurance scheme, perhaps the hospital insurance scheme is not run properly, and there are questions of how the money collected currently is used. So there are those concerns. And we do know that in terms of the amendment bill, the Association of Kenya Insurers and the Central Organization of Trade Unions have also expressed their reservations about this NHIF amendment bill.